First, let's get clear on what anxiety actually is. Normal anxiety? That's your brain's alarm system. It's what helped our ancestors survive when facing real threats. A little anxiety before a job interview, exam, or first date? Totally normal. But anxiety disorder? That's when your alarm system goes haywire. It's like having a smoke detector that goes off when you're just making toast. The threat isn't real, but your body reacts like it is. So, how big of a deal is this? Let's look at the numbers. Worldwide, the World Health Organization estimates that 359 million people live with an anxiety disorder. That's larger than the entire population of United States of America. And here in the USA, according to the National Institute of Mental Health, anxiety disorders are the most common mental illness, affecting over 19% of the adult population each year. That's nearly 1 in 5 adults. Here's what's really interesting. Anxiety disorders cost the USA more than $42 billion annually in healthcare costs. But here's the good news. Anxiety is highly treatable. Yet only about 37% of people with anxiety disorders receive treatment. So what causes it? It's usually not one thing, but a combination of factors. Number 1, brain chemistry. An imbalance in brain chemicals like serotonin, dopamine, and norepinephrine can play a huge role. Number 2, genetics. If anxiety runs in your family, you're 2 to 6 times more likely to develop an anxiety disorder. Number 3, personality. People who are more prone to perfectionism or are naturally timid may be more susceptible. Number 4, life events. Trauma, abuse, or a buildup of major stress like financial problems or a chronic illness can trigger anxiety disorders. Number 5, medical conditions. Thyroid problems, heart conditions, diabetes, and even chronic pain can cause or worsen anxiety symptoms. Now, who's most at risk? Women are twice as likely as men to develop anxiety disorders. People with other mental health conditions, those with chronic medical conditions, and anyone experiencing major life stressors are also at higher risk. And here's something important. Childhood trauma significantly increases your risk up to 3 times higher than those without traumatic experiences. Anxiety isn't just in your head, it affects your whole body. Let's break down the signs. Mental signs include constant worry that you can't control, feeling restless or on edge, difficulty concentrating, like your mind just went blank, irritability, small things set you off, you're snapping at people more than usual, sleep problems, difficulty falling asleep or oversleeping. Physical signs include racing heart or chest pain, shortness of breath, dizziness or lightheadedness, sweating, trembling, or shaking, stomach problems or nausea, fatigue or muscle tension. Now, you might wonder, how do doctors actually diagnose anxiety? There's no single blood test for anxiety, but your doctor will do a thorough evaluation. Common lab or baseline tests include thyroid function tests, TSH, T3, T4, because thyroid problems can mimic anxiety. Complete blood count CBC to check for anemia. Blood glucose tests, because blood sugar imbalances can trigger anxiety-like symptoms. Vitamin B12 and vitamin D levels, deficiencies can worsen anxiety. Cortisol levels, your stress hormone. These tests ensure your anxiety isn't being caused by another medical condition. Your doctor will also do a psychological evaluation using standardized questionnaires like the Generalized Anxiety Disorder 7, the Hamilton Anxiety Rating Scale. Remember, proper diagnosis is crucial because anxiety symptoms can overlap with other conditions. Let's talk food, because what you eat can either calm your anxiety or make it worse. Foods that help anxiety include fatty fish, like salmon and mackerel, packed with omega-3s that support brain health. Fermented foods, like yogurt and kimchi, your gut and brain are connected. A healthy gut helps a healthy mind. Dark leafy greens, rich in magnesium, nature's chill pill. Nuts and seeds, especially almonds and pumpkin seeds for magnesium and zinc. Chamomile and green tea, L-theanine promotes relaxation. Dark chocolate 70% or higher contains mood-boosting compounds. Complex carbs, like oatmeal and whole grains, stabilize blood sugar. Foods to avoid or limit. Caffeine, sorry coffee lovers, but it can trigger panic attacks and worsen anxiety. Alcohol, it might relax you initially, but it disrupts sleep and worsens anxiety long-term. Processed foods and refined sugars cause blood sugar spikes and crashes. High-sodium foods can increase blood pressure and anxiety symptoms. While you can't guarantee preventing all anxiety disorders, There are smart habits you can build to reduce risk and improve resilience. Regular exercise. Just 30 minutes of moderate activity most days can reduce anxiety by up to 48%. Good sleep hygiene. Aim for 7 to 9 hours nightly. Poor sleep and anxiety feed each other. Stress management techniques. Try meditation, deep breathing, or yoga. Limit alcohol and caffeine. Stay connected. Social support is powerful medicine. Set boundaries. Learning to say no reduces overwhelm. Early help. If you start noticing persistent worry or excessive symptoms, acting early helps. If anxiety becomes a disorder and is interfering with your life, there are very effective treatments. A combination of approaches works best. Therapy, specifically cognitive behavioral therapy (CBT), is the gold standard. It helps you identify and change negative thought patterns. 76% of people see significant improvement. Medication, certain antidepressants, and anti-anxiety. Medications can be very effective. This is something to discuss deeply with your doctor. Lifestyle and self-care? We covered earlier, but also include relaxation training, exposure therapy in which patient gradually face feared situations. Regular exercise is a powerful anxiety reducer. Mindfulness, meditation, and ensuring you get 7 to 9 hours of quality sleep are absolute game changers. If left untreated, anxiety can lead to serious complications. Depression, substance abuse, chronic pain, digestive problems, heart disease, and significantly decreased quality of life. It can affect your relationships, career, and physical health. But here's what I want you to remember. Anxiety is real, common, and treatable. Seeking help is a sign of strength. You don't have to white-knuckle your way through life. Understanding what's happening in your body and mind is the first powerful step toward managing it. If this video helped you understand anxiety a little better, give it a thumbs up and share it with someone who might need it. Subscribe for more healthy content.